As cardiovascular disease continues to place growing pressure on Timor-Leste's healthcare system, the Timor-Leste Hearts Fund is working to expand access to life-saving care across the country. CEO Jane Williams sat down with RTTL World News reporter Jerry Madeira to discuss the challenges on the ground and new efforts to strengthen the workforce and improve cardiac data collection.
Could you please tell us what challenges does Timor-Leste's cardiovascular healthcare system face?
Yeah, so I think one of the things that that Timor-Leste specifically focuses on or faces, I guess, in the future is just really high rates of cardiovascular disease. And that's really important because we want people to live healthy, good quality lives where they can undertake all their activities and work and enjoy their family lives. So it's so important to understand the causes for cardiovascular disease, why the rates are so high, what we can do in the community, but also as importantly, what happens when people need treatment in hospitals. So looking at the hospital system is something we focus on specifically, Timor-Leste Hearts Fund. In terms of the workforce, so your cardiologists, your nursing staff, and how they can be trained and supported to provide a different level of cardiac care here in Timor.
How do Timor-Leste Hearts Fund programs, such as caring for healthy hearts, address these challenges?
Yeah, so I think we sort of have three streams that we focus on to try and support and increase heart care in Timor-Leste. One is strategic, so we work with the Ministry of Health. We're very fortunate to have a great relationship with them, and that focuses on things like drafting the National Heart Health Strategic Plan for Timor-Leste, so to help guide decision making and understand what is important and how we can talk to all levels of the system, the health system. So that's a really important conversation and role that we've picked up. In a very similar way, setting up the Cardiac Society of Timor-Leste, supporting that. Again, that allows Timor-Leste to link in internationally. Timor-Leste is now part of the World Heart Federation, so that's a big celebration that happened last year for the first time. Very, very important. Those networks provide not just resources, but knowledge and experience. So I think on a strategic level, that's the kind of work we focus on. Then we also focus on workforce support in Timor-Leste. So our doctors come and do clinics, work very closely with the doctors at the National Hospital in Dili particularly, see patients, but do education and training, both with the doctors and the nursing staff. So kind of three main areas.
How are these programs implemented in rural parts of the country?
Yeah, so it's obviously more challenging in the rural aspects of the country, both in terms of access, so being able to get out and provide that sort of face-to-face support. So where we can, certainly around the strategic things, so the Cardiac Society or drafting the strategic plan, we bring the cardiologists to Dili, so and all the other stakeholders, so that we can have a good collaborative conversation. Just yesterday, actually, we spent the day in Bacau, so to get a better understanding of the hospital, the unique needs of cardiology in Bacau, which are different. You know, every district is different. So we had a really wonderful day understanding what is needed there and where potentially we can help there.
How does Timor-Leste Hearts Fund collaborate with local and international organizations?
So look, we're really fortunate. We have good relationships across a range of people that do great work here. We have a very close relationship with the National Hospital in Dili, particularly with the cardiology team and the nursing staff. So very, very important because that's obviously the work we do. But we also have good relationships with some of the other not-for-profit organisations, the international ones, who also support cardiac care here. They tend to be more in the community, so like Malak Timor, you know, Menzies, St John of God are a great partner. So where we can, we always want to make sure we're integrating our work, so we're not doing something separate to what the rest of the system is doing.
Can you tell us about your recent meeting with President José Ramos Horta?
Yes.
And what support government provides for your work?
So look, we've been so fortunate to meet with the President now on 3 occasions. He is a great supporter of health generally, but particularly the cardiovascular work. He's well aware of the importance of heart health here in Timor-Leste. So we're really fortunate to meet with him, share with him our activities, what we've been doing, update him, but talk to him specifically around a project we're doing at the moment around cardiac data. So one of the things that's really important, both at the ministry for the government, but also for the hospital, is to understand how many patients have what sort of illnesses in a cardiac way, how they're being treated, so that you can determine what sort of care is needed across the whole country, not just in little bits. So we're working currently really closely with the Ministry of Health and with the cardiologists to try and set up a centralised cardiac data system that would capture all the cardiac information for patients in hospitals to have better outcomes. Also helps provide some research, which is really important for Timor-Leste because your context is unique, right? So you want research based on your own country. So that was what we shared with the President yesterday, and he was incredibly supportive. Again, we're really fortunate we have very strong relationships with the Ministry of Health. We've met with them over the last 2 weeks that we've been doing this project here, and they are incredibly supportive. So everyone's great. We're very fortunate, yeah.
Thank you for talking to us.
Thank you. Thank you so much.